Deep plane, facelift, and neck lift under local anesthesia. Why I choose to do them this way. I've received a lot of really great comments asking about the procedure under local, why I do it this way, why a lot of surgeons don't offer it this way, and what a patient actually feels when it's performed in this manner. So this is a great opportunity to do a 3-part series beach walk in which we kind of go in depth on all of these great questions. I choose to do my deep plane face and neck lift solely under local anesthesia with oral sedation for a lot of reasons. And what that means is that my patients have oral sedative, typically Valium with some other medications that help that Valium work a little bit better. But it's an oral sedative that relaxes you, as well as an injectable medication that makes everything numb, so I'm able to perform this procedure painlessly. A deep plane face and neck lift under local does not involve having an IV, and it does not include having any IV medications given, and we'll talk a little bit about why that is. The number one reason I choose to do my deep plane face and neck lifts under local is that a typical deep plane involves a large anesthetic exposure because it simply takes a long time. So a deep plane face and neck lift is a much more involved procedure that involves ligamentous release, addressing the entire face and neck, and that sort of comprehensive procedure it takes time under anesthesia, and all things included from getting you prepped and draped down to getting you cleaned up and wrapped up at the end. That's about 4 hours in anyone's hand. That's a long time to be receiving medication through an IV because those medications build up in your system. And additionally, we're rarely doing a deep plane face and neck lift in isolation. Typically, patients are also having brow lifts and blepharoplasties, fat grafting, laser, lip lifts, all things that add additional time. And so often these procedures end up being 6+ hours of actual operative time. And at that point, after having 6 hours of IV anesthetic run through during a sedation procedure and or being on a ventilator for general anesthesia, these have a significant systemic risk. And for a lot of patients that I've dealt with, this risk was just unacceptable. And many of the patients I see would not or could not have pursued this procedure under traditional methods. Either they had advanced age, they had other medical problems, they had had terrible experiences previously with either sedation or anesthesia, or they just had health concerns about the risk of having that much medication procedure and simply didn't think that the risk associated with that warranted the benefit of having a facelift. And so for my patients, I'm able to offer the full benefits of a deep plane facelift without having to have those sort of systemic risks. Doing this procedure under local anesthesia with oral sedation lowers the risk of these systemic events, the scary things like heart attack, stroke, pneumonia. It decreases these to the risk of a dental procedure and the risk of a facelift in isolation. So the scary things on those consent forms are always the major medical risks. And in doing this under local, we are able to skip many of those because I'm not doing anything to make your facelift day any different than a normal day. And finally, in doing a deep plane face and neck lift under local, I have a lot more control over the patient. I can have you move. I have normal muscle tone. And so I feel in my hands, I'm able to get a much better, much more natural result because on the table already, I can see what you're actually going to look like post-operatively. I am not dealing with having a breathing tube in your airway or something supporting your chin that's going to be distorting normal anatomy and affecting the sort of lift we're doing intraoperatively that's going to look different or unnatural post-operatively. So I feel like doing this under local gives all the benefits of lowered risk, opportunity for more patients, as well as a better result in my hands. And that's why I choose to perform this procedure under local with oral sedation. So thank you for coming with me on this beach walk. If you have any other topics you would like to hear me cover in one of these beach walks, please leave them below in the comments, and otherwise have a good day.